Welcome, everyone. Today, we will explore how cultural competency impacts healthcare and why it is so essential in diverse caregiving environments. And this topic is very sentimental to me because my entire life I worked with geriatrics and I've had geriatrics from all different kind of cultures. And it's important to make them feel comfortable. If they're not comfortable, they're not going to tell you the honest truth about like pain, what's going on, or they're going to feel some type of way like they don't respect me. So this is very important for me. Moving forward to my introduction, why does this topic matter? It's just crucial in the modern day healthcare settings. I was inspired by an interview with a Spanish psychologist who also shared firsthand experience with challenges in the USA she's experienced. There are definitely a lot of workshop goals. I want to understand the role of the cultural identity within patients' experience, address the language barriers, bias, systematic challenges. Through my interview, I gained a deeper appreciation of how cultural identity influenced both personal and professional life in healthcare. It's kind of nice to see where somebody else from a different cultural stands, as in for me. I'm very thankful how I get treated, and it's a shame that other people get treated differently during a cultural. Um, I do want to ask a reflective question. I want you all to think about a time when cultural differences impact a healthcare interaction and how did it influence the quality of care. So beginning this presentation, I said how it is important to respect a person's, even the patient, because if you don't give them the same care, it's going to come out bad. The key takeaways for my interviewee was having that cultural identity is a source of strength and challenge. Also, the language barriers were affecting the patient's trust in treatment. Stereotyping and biasing influence healthcare experience, which that's always going to happen. The resilience and growth is how my interview turned disadvantages into assets. Like she had that good mindset. Um, and she also used that to improve the patient communication. My interviewee also recalled feeling underestimated due to her accent, yet she transformed this into a personal strength. And that is amazing. Moving forward to my research and findings of the best practices, some key studies that I have found are the cultural competency improves patient outcomes, language will access enhance care quality, the healthcare bias affects diagnosis and treatment. The other challenges are the bias in patient provider relationships, the lack of training that goes on within healthcare when it comes to cultural sensitivity, and the need for stronger language access policies. Some of the best practices for cultural competency is the healthcare interventions, which could be providing language access services in any clinical settings. I think this is very important. Encouraging inclusive training programs for medical professionals, designing cultural relevant care plans to improve the patient's trust. And then when it comes to advocacy, you could support the policies by promoting the diversity in healthcare leadership. And I also think engaging in multicultural voices is very important when it comes to policy discussion. Research has definitely confirmed that cultural competent training leads to better patient provider relationships and also reduces the health disparities. Definitely building on these findings, it explores how we can apply the best practice in the world healthcare settings. Here's a little simple chart that compares the healthcare outcomes before and after the cultural interventions. You can see as it says health issues with mental health, diabetes, cancer, cardiovascular disease, and other, including tobacco use, age and disability care, hepatitis, and children's health. And also, these are all the intervention strategies, and then the outcomes always helped the situation of the health issues. So I think this is very beneficial. As you can see, the health outcomes for cardiovascular and other things are reduced in depression severity, improve the quality of life, all of that. So I think that's very important, and I like this little chart just to show you guys. Moving forward to the conclusion and the takeaway to home. Some key takeaways to remember is the cultural competency improves patients' experience and outcomes. Addressing the biasness and language barriers is essential to healthcare. I think advocating and education to people are key, fostering inclusive caregiving environments. The call to action is identify one way to integrate cultural competency into your work. and use that and be the person to advocate and start something new. Also, supporting policy incentives that promote inclusives in healthcare settings is very important. Um, Healthcare providers must recognize the cultural diversity as a core element of patient care, not an afterthought at all. Lastly, this is just my reference page, and I did want to go over that cultural competency in healthcare is more than just an ideal, it is necessary. As healthcare professionals, we must recognize that every patient brings their own cultural background, experience, and perspectives into their care. And by fostering these, breaking down languages barriers, and advocating for cultural responsive practice, we can ensure equitable treatment for all. Moving forward, I challenge each of us to identify one concrete step that we can take to integrate cultural competency into our work, whether it's advocacy, education, and direct patient interaction. Together, we have the power to create healthcare environments that are not only inclusive but truly informative. Thank you.